Hey, good morning. It's Dr. Stephen Stites here at the University of Kansas Health System, broadcasting live with you from the Dolphin Simons Family Studio. Welcome back. It's not to Open Mics with Dr. Stites. It's Wednesday morning, the 10th. Rain is on the way, but we have a pretty interesting program today. We talk a lot about COVID, but today we're going to talk about something else. It's a sobering number. We're going to talk about COVID too. According to the CDC, approximately 12,000 children and young adults ages 1 to 19 years die from unintentional injuries each year. And one group is working to reduce that number. We'll explore how they plan to do that on today's show. This is really, I can't how important this is. Okay, so a little quick story about myself. Before I go there, a reminder to take your questions, put them into YouTube, Facebook, and the Medical News Network. You'll find those links to those things right here on your screen. So a long time ago, a very long time ago, I was trying to decide between internal medicine and pediatrics. I did a rotation at Children's Mercy Hospital. I worked in the ER there for a month. And I remember that like there is no tomorrow. So I really enjoyed it, love taking care of kids. And then a lawnmower accident came in, and a child had lost their leg.
Yeah.
And been riding in somebody's lap, and the lawnmower overturned, and it's one of those riding lawnmowers. And I will never forget that, because at that moment I said, I cannot be a pediatric physician, because I'm fine with the well kids, but these sick kids are kicking my heart. And I went on into adult medicine, and I loved it, had a great career. But I remember that formative moment, and I remember the pain, the anxiety. It's one thing if I'm sick, to make a child or a grandchild be hurt or injured. I can't imagine the burden of that for all of your life. And so I welcomed this conversation today. I think it's going to be hard. I'm delighted to have our panel here with us this morning. But first, before I introduce them, Dana Hawkinson.
Yeah, hi. So cases today, holding steady, 16 active infections, 2 in the ICU, 1 in the on the ventilator. 3 in the ICU, 1 on the ventilator. So basically, we have 1 fully vaccinated patient in those 16 active infections. We also have 21 additional meeting that recovery period, recovery criteria, so 37 total infections. But
just hovering right
we're
there.
Just hovering
right there.
Yeah.
And guys, when we talk about that, can we just throw those maps up there for just a moment? I wanted to talk a little bit about these maps, and this is a map we talk a lot about. These are hotspots in the United States. A couple weeks ago, about a month and a half, 2 months ago, we were showing these a lot. And it was Missouri, especially southern Missouri, but broken into northern Missouri, Iowa, and going north, but it really gone into the southeast. And you can tell now that part of the country, a lot safer. But we've talked more recently about Colorado, Montana, Idaho, going north, and also note the outbreak in the more heavily vaccinated Northeast. Now this, with about 68 to 70% of Americans now over the ages of 18 who've been vaccinated. So we know as much as we talk about anti-vaxxers, really we are making headway. Maybe we want to go faster, but we are making headway. So that's good news. But the places where we're going to be most vulnerable, and look at this map more closely. If you look out there at western Kansas, it's difficult. And you look at this part of the map, this is kind of the map where we think you have the highest levels of risk. And you can see how that deep purple is going. If you look at the following map, and this is one that I think we have to pay attention to, this is the cases by region. If you see Alaska has really kind of had this big pop up there, but then look at the far right of that map. And you can see in 3 out of the 4 regions, cases are trending back up again. Why is that? And the answer is that Delta is different. It's still highly transmissible. The weather's getting colder. Things are starting to pick up in some of these regions. We just have to be cognizant. It's great that we have 70% of eligible Americans over the age of 18 vaccinated, but it's not the whole story. And if you take your masks off and you go inside, we're still at risk, and we have to be very thoughtful about that. So just remember, the rules of infection prevention control, they've kept you safe all the day long up until this moment, and they will keep you safe going forward. Let's see if there's any reporter questions out there today. All right, we got the all clear sign. All right, so injuries are indeed a major source of emergency room visits. Today we have an important discussion. We talked about a moment ago how the CDC says the injuries are the leading cause, or falls the leading cause of injuries for children. Children ages 19 and under account for about 8,000 fall-related visits to the hospital emergency room every day. Joining us this morning is Dr. Kristyn Jeffries from Children's Mercy Hospital, who is active with the national injury prevention efforts here in Kansas City. And welcome back to the program, Dr. Steve Lauer, an outstanding pediatrician here at the University of Kansas Health System. We're going to talk with him about the efforts for primary care aspects to make sure that their families, their patients know about the risk of injuries to children. Dr. Jeffries, let's start with you. That number is startling we just saw, thousands and thousands. What causes so many children to fall?
Yeah, and it's really startling. I think falls we know are the most common cause of injury, and I think you can think about falls from playground equipment. We think of falls from furniture, windows, and so kids are exploring their environment. They're curious about what's going on, and so they're also not the best at assessing risk, and so they take risky behaviors, and that's just part of their development, and they're still getting those motor skills and the coordination. So all those reasons places them at risk for falls injuries.
And okay, parent, raised 3 kids, loved my children so much. My son was a climber.
Yeah.
And he loved to climb. And one night, and I think he was like 2 or 3 years old, and he had turned over chairs and gotten up on a countertop and wanted to get to, like, don't judge me here, a Pop-Tart, and because that was a staple in my household, and our household, and then was on the counter, standing up, getting into the cabinets, and then he couldn't figure out how to get back down. Mom. And fortunately, my wife, who wakes up better than I do in the middle of the night, heard that little voice and got downstairs and got him off the countertop. Had he fallen or landed on that chair, that you look at that kind of event as a parent, and you're like, that's really close to disaster. Right. So how do we look at that question? Why are injuries the leading cause of death in children?
Yeah, it's a great question. I think something we're working to figure out how to best protect kids, but we know that every day 20 children die from preventable injuries, and so if you look at the number of deaths caused by cancer or infection or cardiac reasons or any other reasons combined, they still don't equal the number of deaths caused by injuries. It's really impressive. So kids, we talked about, are curious, and so they're going to be kids, and we can't speed up that development of their brains and their coordination. So it's our responsibility as adults to help make their environment safe for them to play and to live in. So that's why the organization that I'm involved with, the Injury-Free Coalition for Kids, got started, actually. Some physicians noticed that there were injuries occurring in their communities and wanted to try to address those and find evidence-based ways to decrease these injuries and work with their communities. And so we've grown since then in the past 25 years, and so now we're found nationwide and have 40 sites. So
that's approximately a very, very big deal, right?
Yeah.
So your organization is planning an event that turns cities green. You have a green T-shirt on.
I do.
I think
I'm
it
wearing
must
it
be
today.
related somehow. Can you explain what we're going to see and the concept behind it?
Yeah, I'd love to. So next Thursday is, on the 18th of November, is National Injury Prevention Day. This is our second annual event. Last year was our first year, and it was great, but it's even bigger this year. And this is a national effort to try to increase awareness and increase parents' knowledge of tips and ways to keep their kids safe. And so one of the things we're doing is trying to light up the country green. And so green is the color of safety, and so you'll see that pretty regularly with that. And we are going to have monuments in cities lit up nationwide. And so here in Kansas City, actually, we'll have Children's Mercy, St. Luke's, Sporting KC Stadium, Charlie's house and the Longfellow neighborhood are all going to be lighting up green. And so you'll see it throughout the city. Topeka is going to have the Evergy Plaza. And then St. Louis, you'll see the big Ferris wheel is going to be lit up green. And then the Blue Stadium. So we're really excited to see those and for people to ask what's with the green and for us to have the opportunity to talk about injuries. And so
that's a big deal. So now here in Kansas City, we're going to talk a lot about firearm and home safety, like chairs turning over and letting children climb on countertops for Pop-Tarts. There's a lot of things wrong with that. Why are we focusing our attention on all that?
That's a good question. So unfortunately, firearm injuries have become the leading cause of injury-related deaths since 2019. They surpassed motor vehicle crash injuries, which have long been the leading cause of injury deaths in children. And so this is an unfortunate
So it's both unintentional and intentional
That's a
use
good
of
question.
firearms, yeah?
Mm-hmm. Yeah, so it's kind of split up with unintentional or accidental shootings, and then also intentional, which can include homicide and suicide shootings. So.
Ouch, guy, that is just hard.
Yeah,
huh?
and it's only worsened in the pandemic. I mean, children's
Yeah.
hospitals are seeing more and more of these firearm-related injuries, and Kansas City is not immune to that too. So.
Well, and I know, in fact, that we've seen that over with us and over at our Marilike facility, Dr. Lauer.
Yes, it's really the stress of the pandemic and the stress that is put on families has just increased this accident problem.
Yeah.
And Hawk, you and I both are dads. We love our kids.
Yeah.
We do a lot of stuff with them. I know I've been close to a major injury in each of my children. Have you seen that?
No, we've been very lucky and fortunate, but certainly to your point, every time I see children in the hospital, it's just one more reason to be thankful that my children are healthy, and it's really those simple things that help, really, just
And,
understanding how fortunate we are.
We are fortunate. My middle child had an injury playing soccer that travels
right.
with her to this day. I know that with the post-concussion syndrome, and then so you just look at that. My oldest one, who's always the risk taker and loved to jump off cliffs down in the Ozarks and jump into the rivers, and we would always try to make sure there weren't rocks right where she was going. But or jump off, things into the wild springs and that kind of riskier behavior. But she's been fortunate. She's not ever encountered that major injury.
Some kids aren't as fortunate, and they do, obviously get injured. And
Yeah.
so we're going to have an event at Charlie's house next week.
Okay, what is Charlie's house?
Yeah.
I don't know. You keep saying Charlie's house. I'm like,
I'd love
Charlie
to.
who? Who's Charlie?
So Charlie's house, for
I
people
know
who-
Charlie Roberts. He's an old
Yeah.
University guy. Hi, Charlie, if you're out there.
So Charlie's house is actually the first safety demonstration house in the United States. And so it's located, we're lucky to have it actually in Kansas City. It's located on Campbell Street in Hospital Hill downtown. So you can actually schedule a tour. They have great demonstrations of different ways children can be injured in the home and what things that parents can do to decrease these risks. And so it was started actually from a family who lost their child to a tip-over accident from furniture. And so their passion has really benefited our community. And so I think that if anyone hasn't checked out Charlie's house, you can get a tour of that.
Okay, so I saw in a picture there's a child standing on a chair climbing. That's exactly what our problem is. How do you prevent that one? Because, people do need places to sit.
Yeah, it's a good question. I think that you can try to decrease risk by not
Bolting the chair to the floor. I thought about that after you climbed on
close
the
supervision is important, but it is
Yeah.
hard, right? Kids climb things, and you like your son, like you wonder how in the world did you get up to?
Yeah, why'd you get up at 2 a.m? Why'd you move a chair over? Did you really want a Pop-Tart that badly? Next time, come ask me if you're hungry in the middle of the night.
Right.
Yeah, I got it. Yeah.
But,
Kids, they kill you.
they do. So.
All right, so we're going to switch gears a little bit. Let's talk about youngsters getting the COVID-19 vaccine. There's a clinic scheduled for tomorrow. Dr. Lauer, talk to us about that.
So here at KU, we are having COVID vaccine for 5 to 17-year-olds in our clinics. Those are set up to run within our regular clinics, so patients coming in for regular visits can get that vaccine, and there's also vaccination slots within our clinic schedules, mainly at our Prairie Village clinic right now because they're filling up quickly. There'll also be some weekend clinics on a Friday evening and Saturday morning at the Southern Clinic here on campus and at our Prairie Village clinic to try and handle the demand, but those are filling up. People are interested in getting their kids signed up as quickly as they can. So the encouragement for any family, 5 to 11, kids 5 to 11 certainly, but not to forget those 12 to 17-year-olds who still have a lot of vaccine opportunities, to give us a call and get those visits scheduled.
Hallelujah. Hallelujah.
Hallelujah. Exactly.
Hallelujah. All right. So, guys, this whole thing is interesting to talk about childhood injuries and then COVID at the same time, because in many ways vaccination is preventing injury from a disease, but there are all these other things. Now, Steve, what do you say to parents when they bring their child in? I take it you're talking about home safety when when parents come in, especially with that newborn.
Well, this is this is not a new problem for general pediatricians. This has been in place forever. I would like to point out that as we mentioned to our medical students when they come in, what's happened over the years is all the infectious disease causes, cancer deaths, all these in children have really declined dramatically over the years, and the accidents just keep in there. So they've gone up in percentages, not necessarily in total numbers dramatically. So again, from our viewpoint, pediatrics is the most successful branch of medicine. But we do have a lot of work.
And can we just say, why is it successful? Great physicians, great nurses, but also the development of new therapies, which
research.
is from science.
Science and research, yes.
And what are vaccinations coming from?
Science.
Science?
Yeah.
Science?
Yes.
That makes
Well backed up.
Yeah, all
But
right, good deal.
I say, but in clinic, this has been going on forever. We've talked to parents at well visits about accident prevention in the home, because it has been a big problem, continues to be a big problem. And I think it's great to have this highlighted, bring this forward and get some resources in front of families so that they can help start addressing these issues at home and cut into these issues. I mean, as Dr. Jeffries said, kids are curious, they're exploring, that's what they're supposed to do, but how do you make those boundaries safe for them to do that, but cut into those accidents that continue to happen?
Listen, I remember my kids, went around, plugged all the every single outlet had those little things on it. You plug it in, and you can never get it out. You can never plug it in electrical equipment. But you know what? That's okay. And then went around and put all the little deals on cabinets, so you had to have it's kind of like, two-factor authentication. You had to do two things at once with your hands to get the cabinets to open. Oh, man, I remember putting all that stuff on. But you know what? Again, that's okay, because what we're trying to do is find ways to prevent injuries. How else can we do it? What else? What can parents think about? What can they do? Where can they go learn about it?
Yeah, I think there's great resources available. The American Academy of Pediatrics has a lot of great resources. HealthyChildren.org is another great place to look. I think recognizing where risk are in your home is important. So if you have firearms, storing them safely, locked and unloaded is an important part. I think using correct car seats intended for your child's size and weight, those are important ways. Preventing burns in your home, in the kitchen, in the bathroom. There's lots of different ways you can do it.
As we head into wintertime, it gets a little seasonal, so the question about burns in house fires starts to rise up again. So families taking a look at how they're heating their house, where those extra heaters are, and making sure they're safe. Summertime, we talk a lot about drowning. There's a lot of water in our area, and I think it's really important that kids, they don't have to be Olympic swimmers, but they have to know how to get to the side of the pool. And that's the kind of thing that families can be proactive on and get things in place to help prevent these kinds of injuries. As you said, it's a terrible thing to happen to any parent. Most of these kinds of injuries, in one way or another, are preventable, and it's a terrible thing for a parent to have to live with. So we really want them to be thinking about these ways to fix these problems, get ahead of it. While you can't bubble wrap them, you got to let the kids be out there and doing stuff. But there's a lot of things that can be done to dramatically reduce these chances of these injuries.
Yeah, that is just so important. And I think that you don't always know. That's what always struck me as a parent, is that you have to really stop and think about it, because you have to really readdress your life. You have to readdress your home and trying to make sure that those kids stay safe. It's all about the priorities, because I just think about the folks with that lawnmower accident.
Right.
How would their lives changed in that instant, and how did that child's life change in that instant? That's just tough.
Yeah. It's heartbreaking for us too. So
It's terrible stuff to see.
Yeah, it is really hard. All right, Jess, let's see what questions we have out there this morning. We could sit here and talk about this for quite a while because we're going to paint the city green, I think, it sounds like, in Charlie's house. But let's see what questions our viewers have.
All right, let's do it. So Dr. Lauer mentioned the bubble wrap. So that's what this question has to do with. And Tiffany was
wrap.
saying as
Don't
parenting
do that.
What's that?
Don't do it. But
Don't really do that. It was being a jest.
Well, let's be honest, though. As parenting has evolved or changed, and that's sometimes criticized, as we know, and we hear the word helicopter parenting and wrapping their kids in bubble wrap. The question is, have we seen that affect the numbers? Have we seen reduced numbers because parents do things differently and are always 2 feet away and hovering over? Some people like that, some people don't. But do we at least see less accidents because of that?
I think the numbers, if you look at it in the big picture, seem to be fairly constant despite all this. There have been some improvements, especially in motor vehicle accidents and injuries there, but the numbers just keep going. And I think it just speaks to the creativity of children and their ability to come up with ways to get to explore that their parents didn't think about. So besides that hovering, I think there's also the idea of, as kids get older, how do you teach them about what is dangerous? A 1-year-old or 2-year-old, you can't have a discussion about electricity and what it means to put your finger in the plug, but an older kid you can. And I think that's, instead of just insulating them, trying to educate them in age-appropriate ways could help on this.
Dr. Jeffries, if you were going to list the top 3 or 4 causes of pediatric injury leading to death, you mentioned firearms, which, man, that's just, come on, we got to do better than that. That's accidental firearms discharges, that just should never happen. But talk to us about the other ones.
Yeah, it depends on the age group. Like they differ actually based on how old the child is. And our younger children, they're at highest risk for drowning, and so that's why it's so important for lessons and to protect, put fencing around your pool or areas around that. For older kids, you may see higher incidence of poisonings, like finding medications in the home or cleaning products and thinking that they're candy or anything like that and drinking those. Motor vehicle crashes are a huge issue in our teenage population as well. They get their license and they want to drive fast and they may not always wear their seatbelts. And I think we've come a long way, like Dr. Lauer was saying, from where we are, and a lot of that is contributed to legislation and safer products and cars and things that we can buy. But there's a lot of room we still have left to do. So the onus is not just on parents. I think there's it's a multi-layered approach to trying to protect kids, but I think that there's a lot of different reasons. I don't know if you have any other things to add.
We're really focusing on the 1 to 19 here, but again, in the babies, the question about safe sleep environment and suffocation, accidental suffocation by parents who are co-bedding is another big area. But otherwise, those are really the big areas that we want to be focusing on.
Okay, so when I would come home late at night back in Rochester, New York, we had our first baby, and I was moonlighting a fair amount. Back then there were no work hour restrictions, and so 120 hours was pretty common. Then you would moonlight on top of that. So I come in on a Saturday night, and moonlit from worked from about the 3 to 11 shift. You get off by 1 or so by the time you got all the transitions of care done. So I get home about 1:30, and my wife's sitting on the couch, and our child was a little colicky when she was our first one was born. Ilea, thanks for that. And so my wife would just hand me the child, and hand me my daughter, and I'd be like, "Oh my God, I'm exhausted." But I could look at her and say, "Oh yeah, you're more tired than I am." So I would take and then Ilea would just cry. I'm like, the only thing that would put that kid to sleep is to put her in the car seat and drive her. And so I'd put her in the car, we'd drive around the town, then I'd stop and bring her in, and she'd start crying to get back in the car. So finally one day about 4 a.m., she was ready to fall, she was asleep. And I brought her home. Is it okay to take the car seat and put it into the crib? Because I used to do that all the time, because I didn't want to wear it. Is that considered an injurious action by a parent?
Oh, it's tough. I feel for you. That sounds really difficult.
Yeah.
But we wouldn't recommend that for safe sleep,
Oh,
unfortunately.
man. I tried to make sure she was a little braced, but She can't move. She can't get out. She's strapped in. And, if it wasn't, one of us is going to not do well in that car wreck because she's going to fall asleep. But yeah, there are challenges to parenting when you get tired and you lose that sense of vigilance.
Exactly.
And I think that's just a setup for a kid because they really depend on that parent to help keep their world safe.
But that's why we want to keep up with the education and getting these preemptive chances. Take a look at Charlie's house and figure out how you can, when you're awake and coherent, you can put some things in place in your house or in your life that will do you well when you hit those tired times, when those things when nobody's thinking very well. And it's like anything, set up the boundaries so that the chances of doing well improve.
Once we finally got a garage, I would just stay in the car and sleep with her. That makes me feel any better. I wasn't a totally negligent parent. Okay. All right, Jill. Jess. Sorry, Jill. Jess.
That's all right. We're often interchangeable. We know that.
Yes. Yes.
So Carol has a question, and I'm glad she asked it because I was going to ask something as well that goes along with this. So Carol wanted to know when a fall should be looked at. And I'm asking this personally because the other day my 8-year-old fell out of a chair. She was just kind of messing around on a kitchen chair. So she fell maybe, I want to say 18 inches, but it was enough to bust her eye open. I thought she needed stitches, but I made the decision to try to fix it myself. Yay, me. But so you see the blood and you're worried about that. But then I text my sister and I said, Sonny fell out of the chair. And she goes, well, every fall should be looked at. So I said, but she didn't fall very far. So the question is, how do you know when a fall should be looked at? And, I would imagine even falling a short amount of time could cause an injury. So what advice do you have?
Yeah, I think we see this all the time. It comes into emergency departments, pediatrician's office. So if you're ever concerned, please feel free to come and see us, obviously. I think if you're concerned that your child lost consciousness with the fall, I think that's an important thing. Or if you're concerned there's a broken bone or a really large gash that's going to need some stitches, I think those are definitely reasons to come see us. But I think you can use... Go ahead.
Every fall would be, you're going to spend
that's
a lot of time in the emergency room.
A lot of bumps and bruises on kids.
For sure.
Okay, so you're probably tired of my showing stories. I have to come and have them all introduced someday. But my middle child, every time she bumped her head, and she's the one that had the soccer injury, but she just got these huge welts. She's this big thing, like, kid, you barely did anything, and boom, there it was.
But again, the questions we'd be asking is, how is your child behaving? Do they seem normal? And frankly, I ask the question a lot of who's bothered most. And when it's the parent, you can probably take a little time at home and make sure they're okay. If the child really seems to be the one most bothered by it, I think that in general is somebody we'd be glad to take a look at.
I like that. That's a good. The parent's the one who's bothered the most. Take your breath. Take your pulse. That's what we say. The first procedure in a cardiac arrest is take your own pulse. Yeah, there you go. Okay. Jill, Jess, whatever your name is, J and J. How about that J and J? That's the play on the COVID crisis right there.
Whatever your name is. Okay, I'll take it.
All right, Jess.
Okay, so Jennifer wants to know, when is the COVID booster expected for those under 18? We live in a high-risk house, and we would really like our teens to have boosters before masks come off in school and before the holidays. Is that anywhere in the future?
Hawkeye, Steve. This ain't been 6 months since they got approved.
Yeah, I haven't heard any or seen any news about that. We know that I think it's Pfizer is really trying to push for boosters for everyone over 18 or additional dosing for everyone over 18. I haven't heard any talk about pediatrics, those that are under 18, getting redosed. And I don't know.
No, I'm not aware of that. And again, I think our biggest push is not to get a third dose into the 12 to 17-year-olds, to get a first dose into the 12 to 17-year-olds, because we have still tremendous opportunities out there with that group.
I think that's right. And plus, if you've had 2 doses already of the Pfizer vaccine in this age group, you still have great protection.
Yeah.
This is the time I would say, take your mask off. You've had 2 doses. That's pretty early. It's not been that approved, but for a few months. And so, really, you have maximal protection. Go out and do whatever you were going to do that you thought you would be more safe after the booster. You're plenty safe right now to do that.
Can we go back and talk about some of the signs that if a child has an injury or a fall and you might think it's slight, is there anything that parents should be looking for or asking their kid that might alert them that they need more help?
Dr. Jeffries.
Yeah, I think, well, first off, if your child can talk. So if you have a young child who's not verbal yet, I think you're going to have to really cue on if they're crying uncontrollably and you can't get them to calm down, or not waking appropriately for feeds or things like that. I think those would be obviously reasons to be concerned. And then if you're an older kid and you're trying to assess, I think looking at some confusion might be concerning things, if you're concerned about a concussion or something. You were speaking about your daughter, but I think that those can be concerning. If they're still having a lot of pain or not able to walk around, those would be concerning signs too.
You know, it's always a thing. Okay, these are parent stories. You're getting parental stories this morning of all my failures. So my oldest decides she's going to rock my younger one, who's in a cradle, and she says, rock, 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 and the child was all Sierra was all bundled up. My oldest kind of rocks a little too high, and all says, whoa! There it goes, boom, falls to the floor. Now, fortunately, carpeted floor. And you think, oh, we go rushing over. Could this be a terrible thing? She's a concussion. And she was still asleep. She never woke up. So we were okay with that. I don't think she did wake up because she had a concussion. She landed on a carpeted floor, fortunately. But, you know, those things, they just happen when you're a parent. And most of the time it's okay. But you do have to know the warning signs of when it's not okay. Mm-hmm. So you mentioned a few. Anything else we should look out for?
I think that's, give us a call. There's always somebody available to talk to you and work through these things and ask some of these questions. And I think that's probably the most helpful one, because when that happens, nobody's thinking very clearly. But again, bottom line is if you have any questions at all, give us a call, or if that's not possible, come in. I do think the younger they are, the more that multiple assessment, including by healthcare providers, is helpful. But as they get older, you know, give them 5-10 minutes. Are they really getting back to their normal? Are they doing okay? Gives you a lot more time to watch them than just bring them in.
Yeah.
All right. Jess? Jess, are you out there, Jess? We're not hearing you, Jess. So I'm going
to try to make you feel better with my bad parenting story.
Go for it.
So how about this one? How about your newborn baby, Sunny, and you know her, and she's doing very well 8 years
Sunny's
later.
very cool.
But newborn
Yeah,
baby, my first outing, and I had taken off, this goes back to car seat safety, took off her belt in the car, and then I got her while I was adjusting something. Then I brought her into Chipotle in the middle of the lunch hour, and I was holding it really close to the floor, and my baby just rolled out in line at Chipotle onto the floor. And I look over and I'm like, I screamed bloody murder. It was just a nice little roll, but yes, we went to the...
Out she went.
Down she went, rolled out in line. I'm freaking out. I run outside. We went to the ER, had all the things done. So yes, it's... I think you're right. It goes back to what bothers the parent more, for sure. So
really, you were trying to see if your baby could turn into a burrito rolling on the floor. Is that it? Burrito baby.
I did. I was like, it's like Operation Chipotle drop. I did. To this day, I couldn't even go into a Chipotle. I was so traumatized. But anyway.
Okay. I'll help you with that. I'll go in first. Go take that Chipotle order, because I don't have that problem.
Yeah,
apparently.
I know. So swapping bad parenting stories, I know. It happens to all of us. So question from Heather is, unfortunately, we live in a mask optional district. We kept them home this year due to lack of mitigation. They will be fully vaccinated by next summer. So I'm curious what your thoughts are about them returning in-person learning at a masked optional school once they're fully vaccinated. How comfortable would you feel sending your kids or family back in this situation?
What do you think, guys? Hawk?
You know, I mean, I think there's a lot of things to consider there. I mean, keeping kids in school is important.
Right.
Mm-hmm. If they're 12 and over, or actually if they're under, you know, if they're 5 and over, getting them vaccinated. I think that helps. We know vaccination does decrease transmission, although the decrease is a little bit less with the Delta variant compared to other variants, but we know that vaccination does help reduce that as well. And so I think it's really what is your priority in doing those things, and who in your bubble is at risk of further severe disease should somebody bring that virus home and spread it to others. But we've always touted how important it is for kids to be in school. We really appreciated and endorsed the fact about social distancing when available in those facilities. Masking, of course, we have very good data to support that those things work. But I think it is kind of what you prioritize, and I think keeping kids in school is very important. But there are other issues there.
I'd say even in mask optional, that's other people, your responsibilities to your child, and so if we'll keep coming back to it, vaccination is the way out of the pandemic. So having your child vaccinated, they're wearing a mask. What's the school doing otherwise in terms of mitigation strategies that reduce the risk of your child picking up, of getting COVID, balanced with how are they doing at home and how are the parents doing at home, being teachers. And again, we learned, as Dr. Hawkins said, we learned a lot about the importance of having kids in school last year. So there's no single answer for everybody on that, but it is important to be able to get them into school, and so working with your school district and the actual school to understand what they're doing to help mitigate the risk, it would all be in that conversation.
Oh,
Yeah.
I don't know if I can say anything else
Yeah,
to that.
no,
Yeah,
I think,
that's a good
man,
answer.
wear your mask. You're not going to be vaccinated. If you're all together vaccinated, remember it's a 90% reduction for even with children, including children, I should say, in severe hospitalization and death. No question about the importance of vaccination, and there's really no question about the safety of vaccination. And what I am encouraged by, and probably because I worked out this morning, it always puts me in a better mood. But and it leads me to singing the Hallelujah Chorus on the morning media update or on open mics, which they want to turn off when I sing. But what I'm really encouraged by is this thing about watching the America slowly climb up to 68, 70% being vaccinated. What that says is that vaccine hesitancy is slowly fading. And I think what we all have to do is stay on message about its importance and about its safety and about how we can return to normalcy. Some people I've heard say, gosh, we're going to have that Pfizer pill in a little bit, the Merck pill, especially the Pfizer pill, and say, man, that's so effective. Why do I need to be vaccinated? Because you're still going to spread the disease. You're still going to be putting people at risk. This is a two-pronged, actually it's a three-pronged strategy. Get yourself vaccinated. If you get sick, probably in the beginning of this winter, you're going to be taking the COVID pills. And now in the long run, if you continue to practice infection control, what are we going to bring to an end? We're going to bring an end to this thing.
Yeah, and again, anytime you get the disease, you really are rolling the dice with those complications that can occur. Even those pills that have yet to be authorized or approved are not 100% for making you better.
And again, the variants come from infections. Every time there's an infection, there's a chance of a new, the Delta, Super Delta, or some other one. So, we just gotta keep on track on this. And really, now in our practice, and at Children's, everybody, pediatricians and family practice docs, getting this 5 to 17-year-old group vaccinated, getting parents past their concerns, which are legitimate, and get those questions answered so that they'll get their children vaccinated. All
right, Jess, one or two more questions.
Yeah, I've got a couple more questions. Joe Ellen is asking about something that I think is so important. When I was younger, a friend of mine died because she was not wearing a helmet. I think she was 12 or 13 years old and hit her head on the curb and passed away. And so this has always stuck with me. My kids do not get on anything without a bicycle helmet. So
yes.
Just how important is that, and what Joe Ellen just wants to know what that plays as far as just importance of safety for kids and numbers.
Oh, it's incredibly important. I mean, helmets have saved countless lives. If you have a helmet on, your risk of head injury is so much lower. And so we know that those are the most serious injuries, are the head injuries. So if anytime they're on, a bicycle, a motorized vehicle, like we often see ATVs, off-road vehicles, we see really bad injuries from that, and kids who die from those. And so they should, kids really shouldn't be on ATVs, but if you do ride them, then or choose to have your kid allow them on there, they definitely should be in the proper equipment. And so helmets, when you're on those scooters, there's lots of things that helmets are really useful for.
Okay, so it just scares me when I see these kids all riding those little scooters around that you do a thing, and nobody's wearing a helmet, and you're like, are you kidding me? Why do you think it's any different to be on a scooter than on a bike? Just rawr.
Good question. Very good question.
How does that help anything?
That's adolescent. I mean, that's the problem of dealing with the adolescent brain and low risk and thinking ahead.
Yeah,
so.
unbreakable. Okay.
Yep.
Yep.
Last one, Jess. Jess, we've lost you again.
I did it again. I know. Okay.
It's, you know, it's only been 2 years. Don't worry about it.
We'll get it. I'll get it one of these days. Vicky wants to know, she's a little frustrated. I just saw a post on Facebook stating kids don't die from COVID, so why are people wanting to get their kids vaccinated? Please keep reminding us the problems to have to children if they do not get their kids vaccinated. What is the warning to parents?
Yeah, first warning is stop doing the MUNs, made up news network. That's what we call the internet. It is not real news. Hawkeye, kids die from COVID. Newsflash.
Yeah, again, I think it really needs to go back to really understanding what is the accurate, most up-to-date information. Certainly when the pandemic first hit, we saw that kids were not really affected. You know, that holds true for the majority. But we do have updated information now, and so it's really, you know, coming back, not really using the 2020 data, but really the 2021 data. We do know and understand that although the majority of children will not suffer a lot of ill effects, we know they do have risk of severe disease and going to the hospital and dying, although it's small, thankfully. We do know that they can be affected by long COVID symptoms. I mean, we've talked about how heartbreaking it is to see a child who's hurt or sick or ill. What about a child who can't be out running and jumping and playing on the jungle gym because they have that fatigue or they have chronic cough or headache? We know that they can be affected by multi-system inflammatory disorder. But in addition, we also know that children can spread the disease to others. And so it is also important to get vaccinated for that. We know that you can have a decrease in transmission from vaccination. So there are a myriad of reasons to get children vaccinated.
Not to mention, Steve, still no major risk from vaccination in children. It's really safe, including
safe.
the myocarditis thing. Not a big deal.
That one, and it came up in a conversation yesterday with the mom in clinic, and I think this gets back to the way some things are presented. What the vaccine actually does is have about a 90% reduction in the chance of getting myocarditis from COVID. But it's out there, so there's a risk from the vaccine, which seems to be true, but compared to infection, greatly reduced by getting your child vaccinated.
And the risk is it's a very mild self-limited.
very mild
It doesn't matter. So the reality is no major side effects.
Correct.
Yeah.
No major side effects related to this. In our world, there is no such thing as an acceptable death, and that's that just isn't. These are preventable.
And I think that was a great point, too. Your risk of actually, if you get the infection, the virus, for those adolescent boys, they have a 6 times higher chance of getting myocarditis from the infection than they do the vaccine. If you're an adolescent girl, you have, I believe it's like a 20 times higher chance of getting myocarditis from the infection compared to the vaccine. So it is very important for that reason as well.
And again, the vaccine-induced myocarditis is nothing. The COVID-induced myocarditis, well, that's something, and it's bad. And the one thing, the other problem with children is, and we heard it yesterday from one of our parents, right? The child was left with asthma. I mean, you get underlying lung disease and fibrosis and scarring. This is the real stuff. And so maybe you don't even die, but you still have the real stuff, and the real stuff is bad stuff. So why do you want to take a risk of bad stuff when you get vaccinated and eliminate the risk? This is like, science versus made-up news, right? Which one are you going to choose? Remember, every time you take a medication, you're taking it on the basis of science. Why not take vaccination when it has been proven over 1 billion times how safe it is? So, Jess?
Hey, Dr. Stites, so on that note, we've been asking people to send in photos of their kids getting their vaccine and celebrating and giving us the thumbs up. So I want to just give a quick shout out to Hudson and Carson. Very excited to get their shots yesterday. So we're just asking parents and caregivers to send in pictures so that we can encourage other people to get their kids vaccinated and kind of give a shout out to these kiddos for doing it right.
I love it. That is doing it right. All right, well, let's get to final thoughts from our guest, Dr. Jeffries. I'm going to start with you. You look good in green. Love the whole green light thing. Help us get a reminder about this injury prevention.
Yeah. So we've heard multiple times injuries are preventable, and National Injury Prevention Day, I think, is a really unique opportunity that we have next week on the 18th to really raise awareness and help families find ways to prevent these injuries. And so we encourage you, there's a couple of different ways you can find information. You can find it at our website on injuryfree.org. You can pick up a green light bulb at Charlie's house if you're interested in lighting your own porch up green. And then we're actually going to have a Twitter chat if you're on Twitter next week at 12 p.m. Central Time. So the hashtag's #BeInjuryFree. And we're on all the social media channels, so you can always find us on any of those at Injury Free Kids.
And
so.
that part is not fake news. So that's
No,
good.
we share a lot of great tips. So.
All right, Dr. Lauer.
Again, just keep talking with your child's healthcare provider about these ways to help prevent these injuries. It's an ongoing one. Kids grow up and get older, and they just keep finding new ways to come up with injuries. So it's part of being a parent, and we're glad to be a part of helping you with that.
Yeah. Again, these vaccines, the benefits greatly outweigh any risks associated with the vaccines, even for children. We've just talked about the complications that can occur when you get the infection itself, and those complications you're at higher risk of those than anything from the vaccine. Also, just got word as well that there's been another paper retracted because of false or inaccurate information about the benefits of ivermectin and the Math Plus regimen as well. So they had touted the mortality rate as 6% when it was actually 28% in those people getting ivermectin and the Math Plus. So second article retracted this year from that author. So again, I think we continue to be consistent and adhere to the NIH treatment guidelines, which we are doing here. And also, we know that KU basketball got a win last night.
They did get a win
so they
last
trail
night against Michigan State.
Kentucky now for all-time Division I men's basketball wins by only 3. And of course, we have our not-so-secret weapon, head coach Bill Self. So hopefully we can overtake Kentucky this year.
You're not a shout-out at all. You're not a homer at all.
They look pretty good.
Yeah. All right. Well, listen, just remember that in the court of reality, COVID is guilty. They're guilty of doing bad things to you and to children. Vaccines are not guilty. They are safe, and they keep us all safe. And we love the work of Dr. Jeffries and the team for helping prevent injuries in children. Every time I told that story, in my heart, when you're with your child and you think, that was a near miss, man, how hard is it if it's not a near miss and it's real hit? Keeping our children safe, keeping our lives safe, keeping each other safe so we can all live long and prosper. We're back tomorrow. We'll see you soon.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.